what we saw was people with multiple conditions, particularly in those first few years, if they lose a family doctor, they absolutely need the support because it impacts them, it impacts our hospitals, and it impacts our healthcare budget.
Frisco and Scott back on Closer Look, another episode here across the Village Media Network. I don't know about you, and I don't know about Derek. I don't want to speak for you two, but I am still reeling from yesterday's overtime win.
That was crazy.
Canada and Czechia.
That was crazy. I never stopped working, as you know.
No.
But
no.
I did in the third period. I couldn't focus on anything else because it was so dramatic.
Yeah.
And first, Canada tied the game, 2-2, and then Czechia took the lead. And I didn't realize till after the game. Forget all the stuff that happened. There was too many players on the ice.
Apparently, nobody knew. None of the players knew. None of the coaching staff knew. Apparently, the officials certainly didn't know.
I don't mean to veer, but shouldn't one of the coaches in Canada be watching that? Like, isn't that one of their jobs? Like maybe there's a behind-the-scenes conversation going on saying, hey, guys, pay attention.
Yeah.
Right? Even when they showed the celebration, there's 6 guys are celebrating the goal.
But nobody thought
noticed.
to go,
1, 2, 3, I know. Well, you can't even try. When I first saw it on social media a couple hours after the game, I thought, oh, this is all fake, right?
Yeah, it's got to be.
Someone's just making up pictures.
AI generated.
AI generated, but it was true. But that was phenomenal. That was phenomenal. The fact that Suzuki could put that tip in from 3 feet outside the net, and then Marner's goal was legendary. It was amazing.
It was, and the three of us were in here, watching it, and it was just a roller coaster of emotions. We thought it was done when it was 3-2, and
the whole country thought it was done. Could you imagine just across the country, people were, just at schools, in offices, at home.
Would have been terrible. But then we made it to overtime, which was great. I'm not wild about the 3-on-3 thing.
No, I
talked
hate
about
that.
It just seems so sacrilegious.
It's so anti-hockey. It should be 5-on-5, play till you score, right?
But what a
and the thought that it would have gone to a shootout, that's horrible. That's a
terrible way to end.
That's terrible.
Awful.
It really is an awful way.
But it was crazy.
It had my heart going. It made me
all of ours.
Made me think one of us need to see a doctor.
Exactly. Yeah. Well, I love the segue. Just such a chess game back and forth, right? 3-on-3, and then Marner with the final move, and I guess you could say Czechia mate. Boom, and we advanced.
Did you see the Czechia coach complaining about the reffing? And did you see that? And he actually said the refs were so bad it was as if Canada was playing with 6 players. Like, how ironic. Buddy, you're the team that had 6 players on.
All right, to doctors. Sorry, I spoiled your segue.
If your heart was racing, you didn't have a family doctor, you might have had to end up at a merge. It was so stressful.
If we proved nothing yesterday, we proved that the three of us do in fact have hearts.
Yes,
they were.
Yes, sort of.
They were beating.
Some days.
Yeah. All right.
Yes, we're going to talk about some research that came out yesterday, which is fascinating. And when I first read the headline, Ontarians who lost their family doctor face a higher risk of death, especially in the first 5 years.
What a headline.
Yeah, it seems obvious. Okay, that makes sense, right? But it's actually really a detailed study, and it really opened my eyes to things I didn't realize. And so the team of researchers looked into the data, which is available to them, and realized it really, really confirms just how important it is to have that continuity of a family doctor, someone who's watching you and seeing you. And when you lose that thing, when you lose that access to that doctor, you're suddenly like at sea with on a buoy, right? You don't. I might go to a merge. I might go to a walk-in clinic. So your risk of death or serious, problems really increases. And it's important because right now the Ford government is promising everyone a family care provider by 2029. They're working hard at it, and they're making progress. And they're actually what's the word I'm looking for?
Above the curve.
They're ahead of what they predicted, where they predicted they would be at this point, right?
Yes.
And so they're trying to blanket certain parts of the province with family doctors, especially in postcodes where there's none, right?
Right. Yeah.
What this study seems to suggest is that we also need to be looking at giving family doctors to those high-risk patients that lose their doctors.
Yes.
Because it's going to actually help us in the longer term keep people out of the emerge, keep people up from calling 911 to have that kind of care. So
they're pacing ahead.
Yes.
Derek just tells me in my ear.
Yeah, exactly. Thank you, Derek. Thank you. So we're going to talk to the lead researcher on this work, and I think it's going to be a fascinating conversation.
2 million Ontarians don't have a family doctor, and now research suggests that for some of them, that gap in care isn't just inconvenient, it can be deadly. A sweeping study of more than 12 million people found that losing a family physician significantly increases the risk of death, especially in the first 5 years. And for patients with multiple chronic conditions, that risk isn't just higher, it's dramatically higher. So what does this mean for the province's plan to connect everyone to primary care by the year 2029? And are we prioritizing the right patients? We're joined tonight by the study's lead author, Dr. Jonathan Fitzsimon from the University of Ottawa. Doctor, appreciate your time. Good to see you tonight.
Thank you. Delighted to be here.
All right. As part of this study, Doctor, you and the other researchers poured through 12 million health records. Can I start by asking you where those records come from and how you even begin to go through that much data?
Yeah, well, we're actually very fortunate in Ontario that we have centralized databases of population level health data. So, every touch point with a hospital, with a family doctor, with any sort of clinical, provincially funded service, that data gets reported and recorded and is held centrally in an organization called ICS. And then researchers like myself can apply to have access to those whole population level databases.
Can you tell us what you found?
Yeah, well, it was pretty dramatic. We were not surprised to see the evidence confirming international evidence that long-term attachment to a family doctor, so having the same doctor for several years, is very protective. You get very positive outcomes to your health. So we certainly saw and confirmed that on the Ontario data. But what we did see is that people who have periods without primary care, so no family doctor, no access to a regular primary care clinician, particularly if you have chronic conditions and multiple chronic conditions, those people saw a dramatic increase in their risk of death in the observation period. So we looked at records for a 1 year window. And those increases were dramatic. So if you adjust for all of the factors like people's age and the sex and whether they live in a rural community or an urban community, all of the things being equal, multiple chronic conditions, not having a doctor compared to having a family doctor led to twice the risk of death. Mm-hmm. And that is just a risk sort of factor that we rarely see in medicine. That's hugely significant.
Mm-hmm. I was going to ask you, Jonathan, because when you read the headlines to this story, it seems to the layperson like me, kind of obvious. If you don't have a doctor, your rate of death might be higher. Your risk of death might be higher. But the reality is, when you dig into the data, it is pretty shocking. Did it surprise even you that it was as bad as it was?
Yeah, certainly it surprised me. When you actually do the comparison to people without chronic disease, so, look at people that don't have any long-term conditions and then they get attached to a doctor, and then you compare them to people that have lots of chronic conditions and don't have a doctor, that risk association is 12-fold increase. Like, we do not see orders of magnitude increases like that when we look at, medical diagnoses. Your risk of dying, due to a diagnosis of diabetes goes up about 85%, like 1.85. So to see a mortality increase of 12-fold is huge.
Okay, Jonathan, let's dive into what the Ford government is saying. They've pledged to attach every Ontarian to primary care by the year 2029 and say that more than 275,000 people have already been connected. Based on your research, is the current strategy targeting the right people first, and is that goal actually achievable?
So I think I like to give credit where it's due. The commitment of the Ontario government to make sure that all Ontarians are attached to a family doctor or nurse practitioner by 2029, and Dr. Jane Philpott leading those efforts is an amazing commitment. And the fact that we actually have legislation in Ontario now sort of enshrining in law that will be a right of Ontarians by 2029 is a huge leap forward that no other province in Canada has done. I think what the research and the study shows is that as we sort of move over the next few years to get every Ontarian access to primary care, is there a way that we can add additional resource, additional support to this very vulnerable group, the people that actually would most benefit from extra care now, immediately, in an urgent way? because it's not just for them as individuals that we see the benefits. It's the implications for use in our emergency departments and our hospital inpatient units and the overall cost to the healthcare system. It benefits patients, it benefits our system, and it benefits us all through the cost to the healthcare system as well.
Mm-hmm. Do you get a chance to talk to Dr. Philpott at all? And has anyone from the government reacted to this research in particular yet?
Yeah, I do have a chance to talk to Dr. Philpott. She's been very open and candid about, what her challenges are and what her priorities are. And I think the impact of just so many Ontarians being unattached, the problem had got so bad, and this is the same across Canada. I mean, in terms of Canadians, we're looking at over 6 million Canadians that don't have a family doctor. So in Ontario, once that number got past 2 million, I think what Dr. Philpott's priority was to say, look, we need to do something about this now. And what she prioritized initially was going out to the communities with the highest numbers of people. So in effect, looking at the postal codes that had the worst unattachment rates and directing the financial support initially to them. So I'm 100% behind the idea that we should be getting everyone attached. Everyone should benefit from primary care. Maybe for some people, if that happens next year, the year after, there's very little long-term impact. But for others, even another year without a family doctor could have a huge impact on your outcomes. And so I'm advocating for some additional resource and prioritization of that vulnerable group.
That prioritization is so important. We've been very fortunate, Doctor, to have a lot of experts like yourself join us on the show to talk about different aspects of the healthcare system. And it really is about taking that amount of resources you have and distributing it the best you can, right? Because the important point you mentioned is, if someone loses their doctor and they have multiple conditions, it puts a strain on other parts of the healthcare system, right? They end up showing up at emergencies, things like that. Can you speak to that, Doctor?
Absolutely. I think it really is the beauty of primary care. It's why family medicine is a medical specialty in its own right. If you start relying on an emergency department or a walk-in clinic, or even if perhaps you picked up a referral to a specialist, maybe you do have a cardiologist who's helping with your heart condition or a respirologist who's helping with your lung disease. But really having that person who is looking at you holistically, looking at all of your conditions and your lifestyle and other things going on in your family, what's specific to your community, somebody who really knows you and the whole you. That's the role that the family doctor brings, and that's the beauty of family medicine.
So, Jonathan, really, it's a two-pronged problem, right? We've got over 2 million now not attached to a primary care physician in the province, but now we're also facing a wave of physician retirements with another 1.74 million Ontarians attached to doctors over the age of 65. So, are we heading towards an even bigger detachment crisis?
Well, I think what I would say is that it's not there's no silver bullet. There are multiple aspects to this problem, and we need to be smart and we need to work hard and we need to address all of these multiple issues. So you're absolutely right. We are not completely over the demographic time bomb of physicians and other clinicians retiring. So it is vital that we continue with the efforts to increase medical school places, to increase family medicine residency spots, to push out residency programs to the communities that have traditionally been hard to serve. So whether that's rural, remote, northern communities, but also pockets in urban centres, maybe dealing with new Canadians, looking at military families and veterans, the Francophone population. There are lots of pockets of hard-to-serve communities, and we can't just rely on, cash doesn't always solve the problem. It certainly goes a long way. You can grow your team, you can build your resources with more financial money. But sometimes we need to be clever and innovative about how we bring clinicians and how we become more efficient at how we deliver care, and maybe think of completely new ways as well.
Can you speak to that? Because I know you've been on the forefront of some of that. What are some of the ways we should be thinking of maybe doing things a little differently?
Well, I'm heavily involved in digital health and virtual care, and have a keen interest in what sort of AI tools can help optimize the administrative burden on clinics and clinicians. So when I say about being clever and thinking a little outside the box and being innovative, they're the sort of things that I identify with. What can I use which takes away some of the tasks that don't really need me to be doing them? So some of the administrative workload, the administrative burden, that I could better put my time into clinical work and helping patients. Is there another person, or is there a digital tool, or is there an AI-powered sort of process that could do that administrative work for me and for the clinic to free up the time for the clinicians to be helping patients with clinical issues?
Do you feel like we've turned the corner a bit on that, doctors? We've heard about that for the last year or so, but I feel like it's really taking hold, is it not?
Yeah, I would say it's gaining momentum. Has it completely taken hold yet? That might be a stretch too far, but gaining momentum for sure. The simplest, the first, dipping the toe in the water of AI is around people use AI scribe technology. So that's where you have, the AI running in the background, and it can produce a transcript and then an encounter note that automatically can then quickly be reviewed by the doctor before going into the chart. That's a great way of saving time. And we've seen a dramatic uptake in the number of clinicians using AI scribes. Can we start to use more AI tools for that administrative process, that managing data, managing notes, and then starting to sort of flag people at risk, highlight issues that haven't been dealt with, and perhaps even aiding clinicians with the most up-to-date evidence, best practice, clinical guidelines, those sort of things.
Jonathan, I'm blessed. I have a wonderful family doctor. He's just been amazing to me. And I try every time I see him to ask him how he's doing, because I'm blown away by the people that sit in his waiting room and the things I kind of hear around the office and the pressures that they face. Part of the issue is also making sure that you guys are taken care of and that you guys are able to show up every day and do your job. Is there enough in place for that?
Well, one of the things that I think comes out of this study is just the workload that goes with looking after clinically complex patients. And I think, as a family doctor, what I would say is it's incredibly professionally rewarding to help people who have a long list of issues, because you can very quickly see the difference you make in their lives and their families' lives. You reap the reward of your hard work. However, there does come a point where you have to recognize that the amount of work that goes into helping those patients is nowhere near the compensation that goes alongside some of the other work that you can do. And so I think maybe some sort of rebalancing and recognizing the amount of work that's required to take on a patient with multiple chronic conditions is very different than the amount of work taking on a patient, attaching a patient that doesn't have any health concerns, and you're just going to keep them ticking over with access to you if something comes up and giving them proper preventative care and health advice. But it's nothing like the workload of a multi-morbid patient with lots of conditions.
Jonathan, before we let you go tonight, anything that we didn't cover about the research that you wanted to bring up?
No, I think we hit all of the highlights, and if I just quickly reiterate them, that what we saw was people with multiple conditions, particularly in those first few years, if they lose a family doctor, they absolutely need the support, because it impacts them, it impacts our hospitals, and it impacts our healthcare budget.
Are you hopeful that this research might get to Queen's Park and that somebody says, you know what, this is actually a good idea, something we need to think about as we tackle this crisis?
Yeah, absolutely. I'm an optimistic person by nature, but I've also seen the change over the last couple of years, like I say, with the commitment and the legislation by the government, the involvement of Dr. Philpott, the changes and the investment that are taking place. I see progress. I think there's a lot to do. There's a lot of hard work to do, but I think we're on the right track.
All right, there's Dr. Jonathan Fitzsimon joining us from Ottawa tonight. Jonathan, thanks for your time. We appreciate it.
You're welcome. Thanks for hosting me.
Okay, I don't pretend to know a lot of things that go on behind the scenes.
Or anything at all.
Or anything. But I do know this. Our family was derostered due to our family physician retiring. I think it was back in June. And then just before Christmas, we got re-rostered to a new doctor. So, 5.5 months.
Yeah, and we remind people sometimes that our headquarters is in Sault Ste. Marie, where we live, and it was a national story when the group health center here derostered more than 10,000 patients, and a lot of those patients have been re-rostered. Is that the right term?
Yes, eight at least, eight of the 10.
Yeah. And Dr. Philpott, her reputation is as good as it can be, right?
Sure is, yes.
She's a very talented person. and a reputable person. And so to have her kind of as the quarterback of this initiative gives a lot of credibility to it.
Yep.
And I think people are feeling, I think they, I believe when the Ford government in January, marking the 1-year anniversary of this program, said that they're actually ahead of their targets for a number of people who've been attached to a primary care provider. So there are some good things happening. And Jonathan said the same thing, gave them credit where credit is due. As we've learned on this show, there's so many aspects. We would never be able to tackle all the different aspects of the healthcare system that are struggling to get by. There's so many different issues that are in front of us. But this one's fascinating because by 2029, the government is guaranteeing it'll be entrenched in law that everyone has the right to a family provider, which is going to be interesting to see if they can hit that target.
You know what's fascinating to me? I think we've done between, Inside the Village and now Closer Look, we've done close to 400 episodes. And I think if you went back in time, we have.
Wow.
I know. And we're still here. If you went back and checked, I bet you healthcare would be the number one topic because it seems almost weekly.
Yeah. Well,
and it shows the importance
There's
of it,
always something going on too, right? And I think we're going to next week. We'll be talking some more about healthcare. We have some other good things on the go.
You just proved my point.
Our team at Queen's Park, for sure, absolutely.
All right.
Thanks, Scott.
Good stuff. Closer Look at villagemedia.ca. Closerlookpodcast.ca. Sign up. We'll send you content every single night. This evening's program is always produced by the one and only Derek Turner. For Michael Friscolanti, our editor-in-chief, I'm Scott Sexsmith. Thanks for joining us. See you tomorrow night at 7 right here on Closer Look.
Frisco and Scott's Wardrobe provided in part by Moores, Sault Ste. Marie.